This is a recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur on 19th of November. The candidate's name is Prakriti Gupta and the candidate number is 2234. The interlocutor is Sangeeta Gopi and the interlocutor number is 4356. This is role play number 1 for the profession of nursing. Good morning, Prakriti.
Good morning, ma'am.
May I see your identification, please?
Yeah, sure.
Right. Thank you. Fine. Here. Thank you. Prakriti, this is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. We will move on to a warm-up session to get you started. Remember, this is not in any way assessed. Where are you from and can you describe your place?
Sure, I will do that. I'm basically from Sikkim. Sikkim is a state in India, like neighboring state. It's a population for about 7 lakh. The thing what I like most about my place would be the environment, the weather. It's always cold and humid weather. And one thing that is the most attracted by the patient, it is a tourist spot. That is the best thing about my state.
Okay. And do you have a role model?
As a particularly, I don't have any role model, but I take my brother as a role model because he has always inspired me. And if I fail or if anything in my life, he has always been there. He has always a pillar for me there. So I take him.
All right. So can you describe a difficult day at work?
Sure. That's a really tough question because the difficult day at work would be like the first day when I started my job as a lecturer. It was my first day because initially I was working as a nurse in a hospital where we didn't come across many people or talk in front of an audience so much. That day was the first day when I had to teach a subject and 60 students sitting in front of me. That was a really tough day.
All right, Prakriti. Let's move on to the role play now. I'll be taking the part of the patient and you will take the professional role. The role play will last a total of 5 minutes and you will be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions?
No, ma'am.
So yes, you will be given 3 minutes to prepare. Here is your pencil and this is the role play card. You can make notes of the card if you wish to do so. You can look at the card during the test, but you must return it to me at the end of the test. You can start your preparation now. Prakriti, that's the end of your preparation time. You now have 5 minutes for the role play and don't worry if I stop you, that would mean it's the end of your time. Can we start now?
Yeah, sure.
All right. Yes.
Yeah. Very good afternoon, ma'am.
Good afternoon.
Am I talking to Mrs. Phillip?
Yeah, that's right.
Yeah. Mrs. Phillip, how would you like me to address you?
Call me Maria.
Maria, is it? Maria, you look very anxious. May I know the reason behind it?
Yeah, sure. Like I was really waiting to talk to someone about this. See, my husband, he's here in the ICU and there's a surgery to be done and I'm really worried about surgery because he's been a healthy person all the while and and the surgery really creates a lot of questions in my mind. Like, is the surgery really needed? What's the purpose of the surgery?
Yeah, and I'll just first I request you not to stress yourself. As I can see your husband being in ICU, it must be a very tough time for you.
Yes,
okay?
it is.
But you can come down to me and talk to me any moment of time. And I'll clear all your doubts as well. Okay. Before starting about the surgery, I just wanted to confirm few more things with you. Is it okay with you?
Yeah, please go ahead.
This is the first time Mr. Phillip is undergoing any surgery.
Yes, it's the first time. Like I said, he's been healthy throughout.
Yeah.
We've never had to have any kind of hospitalization before.
Okay, that's why the things might be tough for you as well.
Right.
Okay, and one more thing, is he into any medications?
Yes, he does take tablets for his blood pressure. Other than that, nothing.
Allergic to any medications?
No, no.
Okay, so
Medcity OET app. Learn OET listening, reading, writing, speaking, and OET related grammar at your own convenience. Download the app now.
he is scheduled for a cholecystectomy surgery today. And do you have any idea about the cholecystectomy, ma'am?
No, I have no idea. I'm completely blank about it, and that's the other reason why I'm worried.
Yeah. And Mary, I'll guide you through that as well. Okay. Cholecystectomy is a surgery operation done to remove the gallbladder. Okay, due to the gallstones formation has been done. In the Mr. Phillips situation, what we have observed, he is having a constant pain.
Yeah, right.
Yeah, I guess he has been feeling that from previously as well, is it?
Yes, it's been some time now.
Sometime, is it? Yeah, and an observation we found there is some infection. For that, we have scheduled him for a cholecystectomy.
Oh, okay, and I get that now. But I mean, any surgery I think might also have some complications along with it. I mean, does this also have anything that I should be worried about?
Yeah, in every operation, every single operation, there is a mild side effects of it. Okay, mild to severe side effect. In a cholecystectomy surgery, there are few such side effects which a patient can come across. Okay, it can be like difficulty in digesting fat. Fat can be like meat or a dairy products, anything like that. That will be difficulty in digesting. He will be feeling a bloated or fullness in the stomach as well. Fever or indigestion problem, like he can come across a constipation and diarrhea in certain situation. And in the extreme stages, only a patient can have a jaundice.
Oh, there are quite a few things that I should be looking out for.
Yeah, but no need to worry. If you feel any of the symptoms have come to the Mr. Philip or he is having constant pain, anything like that, you can approach to the hospital any moment of the time. As well.
And since you mentioned that he'll have problem digesting fat, I mean, is there anything, any food item that I should, ensure that he doesn't have, and things that I can, safely eat and things? Can you tell me about that?
Yeah, sure, I would do that as well. Before that, I just wanted to know what kind of diet he follows.
Well, to be honest, we eat all sorts of things. Like both of us love trying out food items. So we include meat, we have vegetable items, all of it.
Okay, Mary. So, and after the surgery, there are certain things which you need to follow in a Mr. Phillips diet. Okay, you should choose like a fat-free diet.
Okay.
Please, like avoid using any dairy products that might irritate his stomach.
Okay.
Okay, and fried or greasy foods to avoid as well. And a sauce, that would be enough. And if you have further queries, I'll provide you a leaflet. You can just have a look. If there's anything you feel like, you can follow in that. And also I'll request a dietitian to come and see you, and so she will guide you.
That'll be great, because I, probably can have a detailed, list of things that it'll be safe for me to give him, right?
Yeah.
That'll be great. Yeah.
So to the dietitian, you can just ask her whatever diet you want to follow. She will give you a chart after that, and you can follow that immediately.
Sure. And I have one more thing to clarify. I mean, after the surgery, how long would it take for him to completely get back to normalcy, recovery?
Yeah, I was about to come back to the recovery phases also. After the surgery, we will be shifting him to the recovery day for a 1 day, just observe him in a hospital. After that, most probably a patient takes around 7 to 10 days of a recovery phases. Okay, after that he can slowly, steadily start his normal activity. But please kindly make sure that he takes appropriate rest as well, and avoid any heavy exercise.
Thank you, Prakriti. That's the end of your time.
Download Medcity OET app, available on Play Store and App Store.